agree to that. And there's a few more people coming in, so we might just give it a few minutes to see. But hopefully we have a relatively small group so we can chat. And maybe we won't, because now everyone's joining. All right, I'll give it one more minute and then we'll kick off. All right, there's a few more. There's 5 more people and I'm going to admit them and then we'll get going. All right. Welcome to the Responding to COVID community of practice. For those of you who don't know me, I'm Katherine McKernan. I'm the CEO of Homelessness New South Wales, and this community of practice is being managed by myself and Claire Gardner, who is the manager of the Homelessness Industry and Workforce Development Strategy in at Homelessness New South Wales. And today we were hoping would be a bit more input from you guys to hear from each other, because that is why we set up the community practice, so that you got an opportunity to hear what each other is doing and what you might be concerned about, and then looking about what we can facilitate going forward. But the first thing we thought we might do, because we're just really aware that particularly the old DCJ special on a Friday afternoon, and that wasn't the homelessness team this time, it was actually another part of DCJ, but they sent out what felt like to me, because I was actually, you know, using the fact we can leave our houses and in the pub with some fellow colleague peaks at the time when we got what seemed to be like a wealth of information about the new, you know, as restrictions lift, what we should be doing. So I thought that before we start, and I should just acknowledge that we're on a range of Aboriginal lands and pay my respects to elders past, present and emerging, and I myself am on the land of the Gadigal people of the Eora Nation. And I'd like to welcome you all, obviously, here, but what we thought we'd do just to start is to just get DCJ to, we're assuming that you've been also inundated with emails and you may or may not have had time to read the most recent, it was called a roadmap, so I'm going to keep calling it a roadmap, sorry. There was debate about whether or not roadmap was too linear. So now it's got a longer title, like transition to something. So we might just share that onto the screen to make sure that you've all seen it. And then we might just get Deanne, who's from DCJ, from the homelessness team. So she did not send those emails out at 5:30 on Friday. It was not her. To just kind of go through it, and then we could just get some questions from you guys around what this might mean. And then we thought we'd use the rest of the meeting to really hear from you about what you are worried about and how we can support you in terms of getting you through to the end of the year, really, at this point, particularly in terms of the risk management planning that you need to do. And just we're aware that there's a lot of kind of activity around that, but not really any concrete stuff that you can use to work on. So we just want to hear from you about what might help in terms of if we were to do some extra work on that as well. So hopefully that sounds okay. And obviously, if you've got particular questions and stuff, we also might try and use a portion of the time for people to just brainstorm and learn from each other around some of the stuff that you might be dealing with at the moment as well. So I'm just going to share my screen so that we can check that we've all you know, have a look, maybe first opportunity to look at, okay, why am I not doing it?
Would you like me to, Katherine?
That's all right. It's all good. It was a difficult button, but I found it. So hopefully you can all see that. So that is actually the transition to post-lockdown service delivery for specialist homelessness services document. It was previously called Roadmap. You know, and I guess, do you want to just do a thumbs up, or if you have seen it and had an opportunity to read it? Does anyone be able to do that to see? No, not very. I'm not seeing. No, thumbs down. Okay, so we are. Oh, good, Michelle. Good for you for looking at it, and Linda. That's excellent. But yes, everyone else has not had a chance, and that's completely understandable. So, Dan, I might just hand it over to you to get you to walk everyone through it, given that you managed it.
Sure, and my dog just decided he wanted to participate, but it's fine. I've sent a message to my husband outside, and he's got my thank goodness for mobile phones. So I'm all good. Thank you, all yours. So thanks, Katherine. Thanks for the intro and for setting the scene. So yeah, just really conscious that you received a lot of information late on Friday. This document was part of that, so fully understand that you know, you haven't, and of course trying to fit this all in with your day jobs, haven't had a time to sort of absorb everything in here. We also resent it just to mention on Monday with some comms as well. So that comms on Monday came from the Specialist Homelessness Services mailbox, and it included information around additional payments and a new form that's been put in place that's on the web. And Steve DeReeve, my learned colleague, is also on the line here today, so we can both sort of assist with any questions you might have in relation to that. But just to turn to this, yes, for want of a better word, a roadmap, it's probably easier to say than giving it the lengthy title. This document was produced in partnership with quite a number of subject matter experts and the peaks and various other people in health. We've also received advice from in terms of current links and current information. So we've pulled from a lot of subject matter experts, and really grateful for all that assistance to bring this together. It really includes considerations, so SHS considerations, things to think about as lockdown restrictions ease. So it's, you know, I think as we all know, and as we've learned with COVID, what we learned today is something, but what we learn tomorrow is always something new. There's always something new to learn. COVID twists and turns in terms of responses, and we're working hard to keep up with the most current advice and to update, you know, produce documents like this, but to also update the SHS COVID guidelines as well, to ensure that you have the most up-to-date as possible information at your fingertips. So basically, just to talk through this, I think one of the things to highlight, and I know Katherine, your input into this was really helpful, and you know, is that continuing to monitor the landscape and the COVID landscape, and to be prepared to respond to any changes. So to keep looking at those risk management plans and continuing to update and think about what might need to be changed or tweaked in light of maybe increasing case numbers in your particular patch and further health advice. So basically the document is structured as you see there. And it's also across categories of clients, what you might consider in terms of your clients, as 80% full vaccination, as we know, is reached in the state. What you might consider for in relation to service delivery, and then what you might consider for staff. We've built in obviously the recent policy around the COVID-19 management and vaccination policy that Sophie's previously spoken to it at this community of practice, and we've included some resourcing considerations, and obviously the sort of the broader environmental considerations. And then you move to the 1 December and what might build from, you know, the column on the left, basically. So that's really how we've structured the document. We've included as many links as we could find to updated advice to provide you with those that information that you might be seeking around those various considerations. Apart from that, I guess I don't want to talk too much, Katherine. I think, you probably have enough of people talking through these. It's probably promoting some questions and discussion around this would be great.
Okay. So, I mean, I think in summary really is just a guide for some of the things that you need to consider. Unfortunately, in updating your business continuity plans, your COVID safe plans, and the risk management plan, that all needs to be done as part of this work in terms of keeping everyone healthy and well from COVID. So I think in summary, Deanne, is it good to say that it's basically providing you with some things that you need to think about in terms of moving to face-to-face service delivery, in keeping clients, looking at things if you've deconcentrated or using social distancing, making sure that you consider changes around that, and then also how to keep staff healthy and well, and make sure that you comply with the changing requirements around testing and informing health, etc., around positive cases and so on. So I know too that 2 weeks ago when we met, we also talked about the risk management planning work that needs to be done around vaccination, and Sophie Holloway came and gave a presentation on that. So I'm imagining that you all might be feeling quite overwhelmed about all the planning work that you need to be doing, alongside having been quite busy over the last couple of months in terms of managing what has been a crisis situation. And so really the capacity to do all this planning work in that space is a little bit of a challenge. So I guess the first thing that might be useful to know is just whether or not, maybe we can do a show of hands, if people had an opportunity to look at their risk management planning, their business continuity planning, and their COVID safe planning. Yep. And would you say you're well on track, or, yep, okay, that's good. So there's some people that are saying that. We've got hands being shown and hand function being used. So Michelle, again, across the mode map and also working, which is fantastic, working on this stuff already. But we're seeing fairly few people do that. So, I mean, I guess I thought the first thing might be just to comment on, like, can we get some comments from people who have started this work and just what they have found that they've needed to gather together in terms of what support would be helpful. Jennifer, you stuck your hand up. I'm going to pick on you if that's all right. If you want to just say where you're from, what kind of service you deliver, and what the work you've been doing.
Yeah, we're based in Newcastle, and we work with young people 15 to 24, delivering, intensive outreach supports, mainly around education, training, and employment. So we work collaboratively with SHS services who refer to us. It's an internal referral kind of through SHS. We're not out there for the world because unlike Job Active and places like that, these clients have much more complex needs and barriers. So, and we work with out-of-home care young people as well in the Premier Youth Initiative. So, and we've also got a partnership in domestic violence and working with them as well. So we did our consultation with our staff last Thursday around the risk management plan. We've just found some, I guess, difficulty in getting staff back to face-to-face work with clients. Most of our staff is double vaxxed. We have some staff who have pretty much refused to get vaccinated. So what the risk management plan did help with was, I guess, sort of just highlighting the DCJ policy and sort of talking about that. And because we're such a small organisation, we don't have departments or other jobs that we can move those people into. So just being able to use that plan to discuss that the best protection or control measure for face-to-face delivery with young people is to be double vaccinated. So I found it quite helpful because it kind of, takes the personal out of it in a way, and it's about the service and safe delivery and keeping our staff and clients safe. So I guess, yeah, it was a little bit of a pushback, but in the end, we've just had to say, look, these are the best control measures. there's not much, else that we can put into place because we are such a small organisation. And yeah, we're sort of just working from there. The unvaccinated people have sort of said, well, yeah, we'll go and get vaccinated, and which has been a great outcome, I guess, from it.
Yeah, that is good.
But it's quite, intense, and everybody sort of has different opinions. But yeah, I think the process has been really good, and it's making it very clear on how we respond to COVID cases and, what we need to put in place to ensure the safety of everyone.
Yeah. So can I ask, what documentation did you use in terms of explaining the DCJ policy? Did you use the framework itself that's been set out? How did you communicate with staff about it? Yeah.
Yeah, I sent them all the policy, and also throughout the risk assessment, we had links to the snapshots of the guidelines of what to do, also the WHS Act policy as well, which, then we could say, okay, the acts says that we need to put in the most effective control measures. Yeah, so lots of links, including New South Wales Health, the, health orders. So yeah, the links were all included, trying to give them as much information as possible that is real information and not off Facebook. So, they were able to, I guess, see that, what we were doing was for the best interest of them and our clients, basically.
Yeah, great. Thanks. That's really helpful. Michelle, you put your hand up too, so I'm going to, I don't know if you are feeling okay about talking about what you guys have done as well. Is that possible?
Sure. Hi, everyone. Michelle Bryant. I'm from the Community Restorative Centre. So we have partnerships with 3 other organisations in SHS contracts, and we also have funding from PHNs and New South Wales Health and various other sources. And we work with people, primarily people who are impacted by the criminal justice system, and our model of support is through care, working on an outreach basis. So yeah, for us, the risk assessments were enormously helpful. It was a massive job actually going through, but it was really good because it just made everything really clear in terms of the risks for unvaccinated people versus vaccinated people. We may be a little bit behind where Jennifer is up to, but we've had our consultation with our staff, so we pulled together a PowerPoint presentation, basically drawing on information from DCJ, New South Wales Health, public health orders, having links and attachments and everything that we sent to staff. So we've done that. We've currently got our vaccination policy has been drafted. We're just now just getting legal advice with that, and hopefully by late this week or early next week, it will go out to staff. One of the things that we also did during the consultation, we've got a very clever person who works with us who was able to put together like a survey monkey where we could do it live during the presentation. And so we asked people questions like, what they felt, how they felt about a vaccination policy. Did they feel safe coming into an office working with unvaccinated people? A whole range of questions. And that was actually really good because we were able to see really, most people want a vaccination policy, and most people do not want to work with unvaccinated people. But yeah, for us, it's obviously really important because, yeah, we're going out into the community. We sometimes transport people in cars. So there's a load of risks that we need to consider. So the risk assessment process was enormously helpful with that.
Great. Is there anyone else on the community of practice who has also been through this process who would like to provide kind of an overview of what they've done at all, that didn't stick their hands up to say that they have started or that I missed? No one? My question would be whether or not Jennifer and Michelle, whether or not you'd be prepared to share some of that stuff so that people could potentially adapt it and use it for themselves. Oh, Gillian, you've got your hand up. You go for it. Sorry.
I was just unmuting myself and then thinking, how do I get my hand down? I guess similar to the other ladies. So I'm new to SASI. I've just started 4 weeks ago as their business development officer, and this is the lovely project that I've had to hit the ground running with. So we started consultation, I think 2 or 3 weeks ago, I'm losing track, with the staff, and we presented our draft roadmap to recovery, we called it, with timeframes around getting back to more face-to-face work with clients, and also returning to the office timeframes. And we also developed some proposed protocols to support people with, you know, what would face-to-face contact look like, transportation, to get their feedback on that. And then we started on the risk assessment, and we've sort of broken it up to site specific for our multiple sites, and then sort of into specific tasks. And we've had that's been a lot of work, sort of getting everyone's input into it, making sure they're comfortable with it, getting their feedback. So we finally, today we had our final meeting on the risk assessment, and we're going to just do some finishing touches to that, and then it will go to the board to be adopted, and then we're going to work on the policy. So I'm keen to see, I know we've got the DCJ policy to look at, but I'm keen to see other people's policies. I'm someone to start the process.
Yeah. So yeah, I mean, yeah, that's the biggest thing I think we're aware of, is that everyone's kind of having to do this themselves. And so, I mean, it's great to hear about like the Survey Monkeys and the kind of information that was pulled together by Jennifer, the work that you might have done, Gillian. If you're willing to share that, if you could email that to Claire, or even pop it in if you've got a web link into the chat. That would be real. And anyone else really who's embarked on this, that you think, if you've got things that you think might be useful, I think would really help people. Yeah, so that's the kind of vaccination element of it. And Gillian, you talked a little bit about returning to work and face-to-face contact as well. Are there anyone else who wants to talk about the work that they've sort of been? Yeah, go for it, Jan. Yeah. Can you unmute? You're muted. I'll see if I can unmute.
All right, I found it.
Yeah.
Sorry, we're a very, very small service. I'm from Moving Forward, which is a domestic and family violence case management service. And also too, throughout the lockdown period, I was sharing with the staff some of the stories that my daughter, who's a nurse who was working in a COVID ward. So luckily all my staff are fully vaccinated now. So I think just getting a bit of that firsthand knowledge is helpful too. So as a team, we're all fully vaccinated, but we have done our business continuity plan we've started to come back to the office, and I'm doing different rosters each month to try and work out what's sort of suiting, that we're not all back in the office at the same time. But we will be having face-to-face work with clients who have a vaccination certificate. And if they don't, then we continue to work remotely with them like we have been for the last 15, 16 weeks. So, and we're also starting to have face-to-face workshops. Once again, have to have proof of vaccination, and we'll still take the temperature and wear masks and all of that in the group activities. But yeah, it's sort of like we're thinking that everything's going to be open by the 1st of December anyhow. So let's just start doing it this way and seeing how it goes. But as far as writing up, I'm still working with the woman that's helping me with the risk assessment to try and have that down on paper. But we did have how we would come back and what protective gear we've got. I've got N95 masks and stuff like that here, so that when it's just our staff, we don't need to be masked. But if we're bringing someone in, even with the vaccination certificate, I just think if the staff feel comfortable to wear a mask, and we're asking clients to wear a mask just until it's a little bit later, and then we may, you know, be a bit more casual. But at the moment, maybe not until people have booster shots, not sure.
Sure.
So,
thanks, Jan. That was really helpful. Cassandra, you have your hand up.
Hey guys, I guess for me, so I'm from New Horizons, and for us, we've got the SST program here in Port Macquarie, Kempsey and Coffs Harbour. So being that we're on the mid-north coast, we haven't been in lockdown as such and been working from home. We've still had our doors open and business has been pretty much as normal. So we're sort of working backwards here, which makes it a little bit trickier, especially for staff who during what was the worst for the state, they were out working unvaccinated, with all PPE and within COVID guidelines, but they were able to do their role at what was seen the high point of the pandemic, where now we're going, hey, we're easing it, but now you guys have to follow all of this extra stuff that we didn't have to have. And that's probably the biggest impact for us is for Sydney and the cities and larger places, it's the easing of restrictions where for us, we're actually losing some of our freedoms, and staff being able to get their head around that has been quite difficult.
And so what are some of the things that you've done to manage that, Cassandra, if I can ask?
We're still managing it.
Yeah.
And I guess it's being reliant on the, public health orders, the fact that New Horizons does have a lot of other programs that we provide that fall under other public health orders, such as the mental health, NDIS, etc. So we've been reliant on pulling that information and just drafting, which we're still in the process of trying to finalise our risk assessment of being that we are the front line and probably the most at risk when it comes to exposure, as we're dealing with a cohort of people that are transient, that are rough sleeping, that are couch surfing, that we don't know their medical background, where they've been, they're not QR coding, and we're now in regional where we know we're surge planning. So it's just communicating that to our staff, which hasn't always been easy. As I said, there are people that are staff that have chosen not to be vaccinated, and it's working with those staff to break down why we're making the decisions we are as an organ, as a service. But definitely difficult being, as I said, that we're actually had our freedoms and now we're being told we can't do certain things. We have been able to go out to restaurants and get our hair cut and do all those normal things without vaccination statuses. And now we can't because we're in line with the roadmap.
Yeah. So there are different challenges in different areas based on the experience of the COVID, the most recent, surge in cases. So it is interesting too. I think we are all noting, having had a huge focus on particularly southwestern Sydney, Western Sydney in the inner city, that now the cases are actually increasing in Hunter, New England, and other areas. So it is moving out to the region. So very conscious of the fact that it is a changing environment, and that, things need to be thought through in terms of people who haven't had the kind of significant lockdowns that others might have. So that's a really good point, Cassandra, and a really good to, as Deanne also said, it is quite different depending on where you're from. Gillian has put through a question, or just a comment really, about vaccination certificates. And we did have a brief conversation about what people were requesting of clients a few weeks ago. But I think, Gillian, do you want to just put your question to the group, or I can? It might be worth just having a chat about what people are doing with clients in terms of vaccination certificates or not.
So we weren't aware, I didn't realise that we could or could not ask for a vaccination certificate, and we haven't done. We just act like everybody's got COVID, and that's how we manage the risk. So and if we were to start asking for a vaccination certificate, it would not be well accepted amongst our communities.
Okay, so I don't know, do you want to do Linda, you've got a question too. I'm just wondering whether or not people want to just share what they're doing. I know that some services are asking for vaccination certificates. If people refuse to provide them, then that doesn't mean the service is refused. It's just that how people are being worked, how you work with your client, it might be different based on the risk assessment. Does anyone want to, I don't know, Linda, is your hand up to comment on that? Or if others want to talk about what they're doing?
Yeah, so my hand is actually up to comment on that,
Awesome.
Catherine.
Fantastic.
So it's my understanding that there's been communications that have come out through some DCJ material that we cannot ask a client their vaccination status. And I wish I could pull it up straight away to show you the document, but we're actually been advised that we're not allowed to. We can ask screening questions. So have you been exposed to COVID? Have you been, in an area considered high risk, etc., but we can't actually ask the status. That's my understanding.
Sorry, Katherine, I might just jump in here, and I can probably find the comms. So was that Gillian? Was that Gillian just speaking? Hi,
Linda.
Gillian. Who was it? Sorry?
Was Linda?
Linda, sorry. I'm just trying to track the tiles on my screen. I feel that I saw in the comms from Partnership Support that actually you can ask a screening question around what is your vaccination status, but as per I think a couple of the comms, there is no requirement for services to have clients vaccinated to deliver the service. So just wanted to clarify that. And as I said, I'll find the email just to double check what I'm saying is right, but I'm sure that was what I read from Aleri.
Yeah, that's my understanding of the Aleri comms too. And I will just acknowledge that we have received a huge amount of comms and they're very hard to read. So it's very easy to misinterpret or make assumptions because they're not always worded in the clearest way that they can be. And we have fed that back to Aleri's area on multiple occasions. But yes, that's my understanding as well in terms of what Deanne's just said. So if you can find that documentation, Deanne, that would be great.
I'm just looking for
that.
Great.
Right now. Linda, I don't know if you want to, you've got your hand up again. Do you want to comment further? You don't have to.
No, sorry, I just need to take it down. Sorry.
Yeah, that's all right. Yeah, so I mean, I know that from speaking to some of the inner city services, for example, they are using the screening question, and as I said, they are delivering their services dependent on, like, if people say they're unvaccinated, it doesn't mean they refuse service, but the service is delivered in a different way, so it's not done face to face, for example. So that's an example of some of the ways in which people might be working. I don't know if others want to share what they've been doing in terms of managing that. Anyone? Go for it. I can pick on people if you want. Lisa, do you want to just talk about what WCS has been doing?
In terms of asking for vaccination?
Yep.
Yeah, so we are delivering service to clients who are not vaccinated. In terms of viewing vaccination certificates, we do that. Our understanding is that we just can't, and this applies to staff as well as clients, that we just can't maintain them as a record because there's some confidentiality issue because it's a medical record, but we have cited them. And just to say, Katherine, yeah, we have got a problem with, in terms of where we are in the rollout with we've done our risk assessment. The mandatory vaccination policy is with our staff for consultation. And we have an issue with a staff member who is refusing to get vaccinated. So that is proving very, very challenging. And also working with unvaccinated clients in shelter is also proving very, very challenging because of other clients in shelter. It's just really, really difficult.
Yeah, managing the concern and anxiety around that.
Anxiety, the anxiety from the staff, the anxiety from the other clients in the residence. So it's I don't have any solutions, I'm afraid. It's just
no, that's okay. You can raise issues. That's what it's for, to share also the pain of this as well. So Rob, you've got your hand up.
Yeah.
Want to just say where you're from too? Sorry, Rob.
Sorry, I'm Rob Seaton from Wesley Mission. Look, we're in a bit of limbo. We're certainly working through the plans. 2 weeks ago, I would say that our plans were pretty watertight. There's a nervousness, though, around the easing of restrictions that are so far making it a little bit complicated to come up with definitive plans for the milestone dates for the easing of restrictions. So, and all of this is a little bit subjective. I'm probably more relaxed this week than I was 2 weeks ago. 2 weeks ago, I thought that everything needed to be intensified as things locked down. Our work's continued during the COVID period. So it's not so much a question in most settings about returning to work, but how we just transition to the new landscape. We're asking the vaccination question. By the way, it was Friday's email, I think, that had that comment, and I think the screening question was almost asking point blank if you're vaccinated. That we're asking it in the context, though, of interest, because anyone we're supporting, it's hard to talk about any aspect of life at the moment where it's not a relevant discussion to whatever life domain we're discussing, but also because it's the first question we're asked by public health if there's a COVID event. So it's so we don't demand an answer, but we invite the question and explain why it's helpful to know. And in one of our settings, in a hostel setting, where we're asking for, and I think this is something that we're going to need to change, and it's only been fairly recent anyway, but we're asking people to do a test on their way to the refuge before booking in, not to wait for a result, but to give us a point in time before arrival. And then at public health's suggestion, we suggest a surveillance test each week after that, not mandated, but very strongly encouraged. So we say as part of moving in, we'll be asking you to do this. Are you comfortable with that? And to get the ball rolling, would you mind having a test on the way in? And the reason for that is that it became pretty clear that showing that someone was positive before coming in and then discovering that they're positive once the result came meant a small interruption to services, with a question mark about whether it was contracted at the service. There's a bigger set of implications. So we've been doing that, and I suspect as we build some clarity around that, we'll I could see us potentially eliminating the test for people who are happy to share that they're fully vaccinated. That would be perhaps one of the things that we'll be thinking through in the next 2 weeks.
Great, thank you. That's really helpful. And Rob's talking from a space in which there were in the inner city and areas where he has services where there has been a number of positive cases. So he's maybe a little bit, I guess, more battle scarred in terms of managing, isolating and managing shutdown of services and so on. And so just acknowledging too that everybody has different experiences of this. And so, yeah, just that's where the testing and the surveillance and all of that comes from, because they have had, there has been situations where they've needed to isolate our clients and manage those sorts of circumstances. That kind of segues a little bit. I just wanted to, we've received a draft policy today from not Deanne's area of DCJ, but Larry's again around rapid antigen testing. And one of the things that the DCJ is keen to know from us is whether or not testing of clients using rapid antigen testing would actually assist and support services in this circumstance at the moment. I put caveats around it in that it is still the same. I don't know if you recall when there was discussion around the authorised workers and the whole kind of surveillance of LGAs of concern and the need for testing, surveillance testing. It is still policy at this point that rapid antigen testing has to be delivered by a health practitioner. And so it wouldn't be that your service necessarily would be able to do that. And so there's a number of options that are kind of being canvassed in the policy, which are around things like using the local pharmacist for rapid antigen testing, and or maybe having some hubs potentially in various DCJ offices for that purpose as well. Does anyone have any comments on that? And Di, you've got your hand up hopefully about that, but if not, that's also fine. You can also raise your hand around other things.
Hello everyone, sorry I'm incognito today. It's just been a big few weeks. Albury's really very much under the hammer at the moment. We've had major outbreaks. Someone had sort of said that per capita population, it would be equivalent to 3,000 cases per day that we're experiencing if this were to happen in Sydney. So I guess it's been a really, really bad timing for us in terms of opening back up. The contact tracing is something like a week behind. We're having to do our own contact tracing as best we can. Health have advised us that they're no longer able to tell us whether someone's a close or casual contact. It's up to us to do our own risk assessment around that to determine close and casual, and then how we manage it. So we're really under the pump at the moment. I'm keen to find out more about the rapid antigen testing. We have heard today, I think it was in our local rag, that the home testing kits will be available from Coles and Safeway supermarkets as from next week, 1st of November. So I understand that that would be very different process to the current rapid antigen, where you do need a health professional supervising that process.
Yes, it may be that DCJ's policy is not keeping up with what's being looked at. Deanne, do you want to comment? You look like you want to.
Yeah. I was asked a question earlier on today. Look, I don't have the the solution, so to speak, but I was asked a question from one of our districts earlier on this afternoon if I knew anything. So what I can say, having spoken with someone to try and dig for some further information, is that we are we're waiting on health advice, because these are home testing kits, as I understand it, and we need to understand how that sits in terms of a clinical and non-clinical environment. So that's all I can really update you on, because that's what I scribbled down in terms of the advice. And so, Katherine, if you've got the policy, I guess you might have some more information there.
Yeah.
But yeah.
I don't, but I think I do have a meeting on Monday morning where hopefully I will get some answers. We will have that conversation about all of this, because I think, again, things are rapidly unfolding in different ways. And so maybe by next Wednesday, I'll try and come back with some answers around what's being thought around rapid antigen testing, because in my view, if it's cheap and it's affordable and it works well, it's a really quick way of making sure that you're keeping clients and staff safe. So it looks like a pretty good option, I think. It's just more in one thing we raised with previously when this was being raised as an idea for surveillance testing was the cost and the administration, again, the administrative burden. So keen to make sure that that isn't placed once again back on services. So we'll have a conversation with DCJ about that as well, in terms of how it might be progressed going forward. Is there any other comments around rapid antigen testing or anything else that people want to bring up? I'm sorry to hear, Di, too, that you are under the pump. It is not a fun experience. So I hope that you're managing and that your staff are managing as well. Rob, you had something else to add? That's good.
Just to say that I'm very curious about rapid antigen testing, and have been looking at it a little more closely in the last 2 days since the announcement of the supermarket thing again. It looks like $10 to $15. So with a lot of them, they get expensive pretty quick. But if a few, they're kind of achievable. And the best I can find so far is friends in Liberia who have finger pricks. I haven't seen those ones approved for Australia, but it looks like there's one that doesn't require sticking a swab up your nose, and it, for me, brings into question whether or not we may be able to get our residents to self-administer and to remove the burden of the testing, from staff. Because I think if we're going to administer them, there's a fair amount of risk involved. If we can pass that over to clients and watch it happen, there could be something that's a bit of a game changer, if not at least reassurance for us in the short term.
Oh, great. Di, you wanted to comment?
Yeah, just to comment on that, I think one of the biggest issues here is access to testing. So you let people wait, 4 or 5 hours in a car to be turned around because they're at capacity. We've got people travelling to nearby regional towns because the wait is less, even though the drive's longer. So to have some sort of rapid antigen would at least give people a little bit of peace of mind, I think, for their own well-being. And yeah, perhaps we may not be able to rely on it at this point, but something would be better than nothing.
Yeah. Great. Are there any other comments that people want to make or anything they want to talk about in terms of the current situation and planning? Because if not, what Claire and I have been mulling over after really talking last week, even though that was on the domestic and family violence announcement, just around is, would it be useful for us to run some masterclasses where you actually did your planning work around risk management planning and stuff in the Zoom, with the idea that you come out with either a plan around what we've heard about in terms of surveying staff, putting the plan together, and then, you know, doing the risk management bit, and then putting a plan together? Would that be a useful thing for us to try and organise before the 18th of December, when we're all required to have the risk management plans? If you stick your, oh, we're getting very positive chat yeses. And if so, I know, I'm aware that everyone's on at different points a little bit in terms of the planning. If we started from the very beginning on consultation, would that be a waste of time, or would it be good to start from the beginning with consultation and then next steps and then the policy itself? Or is it better to just do it all in one, I guess is the question I'm asking. Not knowing where you're all at. Beginning, okay, we're getting some beginning. Maybe we'll just do that, and people can choose to come to what is useful for them. All right, so Claire and I might, if you've got any ideas around that, please feel free to chat about them or put them in the chat at the moment. Claire and I will look at rapidly trying to work out how we get that set up relatively quickly. But yeah, we were just thinking, because there was a lot of conversation when Sophie and NCOS presented around templates, but we're just aware of how exhausted and busy everyone is, and we just thought maybe if we set aside an hour each week or something on this, you could just join it, do the work in that hour, and then that would really help speed things along, is what we were kind of thinking. So if that all together, so people, yeah, if you just put in beginning all together, whatever you think is useful, chuck it into the chat and we'll try and work out what we do in the meantime. Yeah, and if there's anything, so what we were also kind of thinking around that too, and I'll just keep talking and people can interrupt and add if they want to, was to try and do it based on, a little bit based on the roadmap thing that DCJ has put together, which is doing the risk management for the vaccination stuff, but also looking at the move to face-to-face, as Jan's kind of talked about a little bit, and others, in terms of how are we going back to the office, how are we going to manage that? And then having a plan too, which Di's kind of reflected, is if there's suddenly surging cases in your area, how do you then pull back rapidly to then be looking at delivering in the setting that you need to be, based on the number of cases in your area? So that's what we were kind of thinking. So by the end of this whole process, you'd have a plan that obviously would probably need to change, because everything has had to change this year, but it would give you, you know, comfort to know that you've got some, you know, you've got things in place for going back to hopefully whatever new COVID normal is, or if it becomes more difficult, you can pull back and you've got plans for both, is what we were kind of thinking. Yes, Jan, go for it.
Yeah, I was just thinking we're really fortunate because we're in Sydney, and you can't even go into JB Hi-Fi without showing your vaccination certificate. So it's become the new normal in a way to show that vaccination certificate. So starting our groups and putting on our flyers that we'll need to have vaccination certificate. Nobody's sort of balking with that, because they can't go to a shop at Westfield without showing their vaccination certificate. After December the 1st, I don't know how we'll get away with that. But also too, it comes down to occupational health and safety. I've got to look after the team, and I have to look after other clients. So, and we're not residential. So we've got a little bit more freedom around that, I think. So that's just why I think we've been able to push that now. Whether we'll be able to do that next year, I don't know.
Yeah, and that's some of the stuff that we do need to think through in terms of the planning as well. And December 1 is not far away, and there has been indications today that may actually be brought forward. So, you know, there's a whole lot of there's a whole lot of things that we need to think through about that. So there's a really good point, Jan. Claire, you had your hand up.
Yeah, thank you. And I'm sorry if I missed it because I joined a little late today, but yeah, I'd just like to get everyone's thinking on how you're handling exemptions, vaccine exemption certificates, and if you've faced those. Are you treating those people as if they're vaccinated? Are we dealing with them differently? Does anybody have any experience on that?
That is a great tricky question. Does anyone have any experience or comments to make on that? No. And is that staff? Claire, can I clarify? Is that staff or clients?
Clients.
Clients. Yeah.
I'd say that we've got the proper surgical masks in our office, and if someone had a genuine medical exemption, then and they desperately needed to see us face to face, then we would make sure that we were masked up with the proper the ones that suck your face, so that and our gloves and our, you know, take the temperature. We would go through all of that rigmarole that we needed to do, because that person has a special need, and so therefore I think we would treat that differently. But whereas if it's just a choice, then, you know, well, then you can choose to be supported virtually. Yeah. Rather than, you know,
it's particularly the exemptions, the medical exemption, that because we're seeing some of those start to come through, and you know, asking for the exemption certificate. So
those special masks are really expensive too. So normally we've got a whole packet of the other blue masks, but these special ones, they're, you know, about $70 for a little box. So it's, you know, but they're for the heavy duty ones, but that would be because that person has no choice in the matter.
So Jennifer, I think you had your hand up as well.
Yeah, I mean, we're just facing someone who's looking to get an exemption. But again, you know, as far as our risk management plan goes, that would change everything, because basically that person is still unvaccinated. And it's all about the risk that poses to our vaccinated staff and how we operate in the office and how that person does face-to-face with young people. So I think it comes back to, you know, basically they are unvaccinated, and you know, I guess the management around that should be around that this person is unvaccinated. And as far as December 1st goes, you know, I think everyone's putting policies in place and sort of saying, you know, like stores are saying they won't be opening the doors post December 1 to unvaccinated people. I don't think it's going to change much as far as, you know, because we're all going through this so that we're set up for that. I don't think it's just going to mean opening the doors to everyone who's unvaccinated just to come in and, you know, do what they want. There's still going to have to be that risk management around, because it's still about keeping our workers and clients safe. That's it.
Yeah, and I think that the Justice Connect webinar on vaccination policy, which if you haven't seen, I really recommend you do, really makes the WHS responsibilities really clear in that space. So yeah. We've got 7 minutes left. So I think what Claire and I have lots of homework in terms of trying to find, if anyone's got some suggestions as a great facilitator for this kind of, you know, hands-on workshop where you come out of it with some, you know, with a plan at least, and if not some draft policies, we'll see how we go. Please just let us know either in the chat or email Claire, who she put her email in the chat earlier. That would be helpful, because we are canvassing. We've had a few thoughts around who we could get, but if you've got any great suggestions, that would be helpful. Is there anything else that people would like to kind of put up around the planning work, the risk management work that they wanted to ask and haven't had a chance to do? No.
Hi, Katherine. It's Belinda Cottrell speaking.
Yep.
Yeah, just was interested this morning. So I did the WDV CAP legal aid, and this discussion came up around, again, clients and also staff. The issue around the medical, again, if it's filled out on the special form, then I guess what people were saying on that forum was that then those staff are treated the same as vaccinated staff. So again, it's just around ensuring that we have all of the safety stuff in place. And the idea is that if once we get to 90%, then, I mean, you can still catch COVID if you're vaccinated. It just means that you're less likely to end up in hospital.
Yep. So are you talking about exempted clients then? Sorry, Belinda, I just got a little bit confused. You were good. Okay, just wanted to clarify that. So just be okay. Yep, great. What we might do is, Dan, you and I can maybe check in with each other and also to the other people. We always have to ask for advice on vaccine people with exemptions. I think it might be good to get potentially some advice on that, given that Belinda's just said that there's been different advice provided from the legal aid space. So we might follow that one up as an action as well.
Yeah, sure.
Yeah. Is there anything else that people would like to raise? Yes, go Joanne.
I just had a question about how people are, because we're based in Western Sydney, but how people are transporting COVID positive clients who may need to be relocated or even get to health appointments. Like, are you using certain cab companies or Uber drivers? Just because it's not always easy to get health to pick, get ambulance services. That's not happening. So just want to know how people are getting around that, because that's been a question for our managers.
Great, that's a great question. Does anyone want to talk about how they've been managing that, who has had positive cases? Go for it, Stephanie.
Hey, sorry, the computer's a little slow today, hence why I've had the video off. But they're really funny you raised that, because I was literally just having a conversation on the phone to a few colleagues around how we actually put this into our living with COVID protocols, which we're actually writing up as we speak. So we've been doing a lot of the, working it out as we go kind of stuff. And now we're really trying to provide blanket guidance for all staff around what we as an employer are expecting them to do. And with the transporting clients, so this might not apply or be helpful for you, but maybe for some in the group, we do out-of-home care and youth housing. So some of our clients live with staff and some live alone and some live with carers. And what we've come up with is guidance. So we don't really know. I mean, it'd be good to get feedback on this, but if the client is a close contact or a casual contact or has symptoms or otherwise needs to get tested or needs to go to an emergency appointment, our experience was anyway that ambulance aren't interested in picking them up. We don't want to expose a cab driver who's probably not wearing PPE and all of that to the client. And so if the client is already with the staff member and therefore has already exposed the staff member, then that staff member transports the client to get tested or to go to an emergency appointment. If in some cases an ambulance would pick them up if it was a genuine emergency, but just for the the more urgent, got to get the client to wherever situations, our protocols are that if the client was a close contact, had COVID, if they had COVID, they're in the hospital, but in theory we may transport them if the worker is already exposed, but they would be wearing full PPE in the back, windows down, and that's what we did. And the staff member has to be vaccinated.
Right.
If the client hasn't been exposed to a staff member, then we are looking and exploring every opportunity for them to make their own way to wherever they need to be. Sort of at a emergency, getting a staff member who's double vaccinated and all of that to take them, just making it as safe as possible.
Great. Thanks, Stephanie. And Deanne's made the very good point in the chat that there is some guidance on that in the COVID-19 guidelines, the SHS guidelines, so section 4.1. So it's good to have a look at that as well. And Linda, you had your hand up. Did you want to quickly talk to that as well, this issue?
Yeah, look, Stephanie had actually just raised some of the points. what we've done here in regional New South Wales is one of my staff was actually went to our local hospital, and she was trained in the correct procedures for donning PPE, and specifically to transport COVID clients, and that was done by infection control. They talked to her about how to minimise it in the motor vehicles and where the client should be sitting in the back of the car. And again, it was pretty much like, I think it was Stephanie that she said, it was the staff person had already been working within the refuge. So we tried to keep it to people that were either casual or close contacts to start with. And just exploring other options, but very much similar to what Stephanie has advised.
Great, thanks so much, Linda. That's an hour, and I'm conscious that everyone does have busy lives and enough Zoom in their lives already. So I'm just going to quickly summarize quite a lot of things that we need to follow up on, which is great. And thank you everyone for the contribution. I think that worked really well. It was great to hear from people other than me and DCJ presenters, no offense, Deanne, and to hear the experiences. It's really, I think, useful, and I hope it's useful for you guys as well. So in terms of follow-up, we will look into having some facilitated sessions in terms of helping people who need to do the work around the risk management planning and so on. And so we'll look at doing that so that you're doing it actively whilst you're in the Zoom, so it's not just another meeting. I will follow up around the rapid antigen testing and report back at via email. I'll do it via email and also by the CO at the community practice next Wednesday around the thinking around rapid antigen testing and how that might be available. We were going to follow up on exempted people who are vaccine exempt and give you some advice on that as well. I think those are the 3 actions. Is that correct? Did I miss any, Claire?
Just one for everybody else to send in any templates or presentations.
Anything you're prepared to share, like if for example, Michelle, if that Survey Monkey could be shared, or the PowerPoint you put together, the work that you did, Jennifer, around consultation with staff, if you're happy to share any of that, please send it through and we will put it together so that people don't have to start from scratch. So yeah, that's an hour. Thanks so much, Jennifer. Thank you, everyone. And thanks again. It was lovely to see you all. And we'll keep these going for as long as we need them. But the main thing will be setting up those masterclasses. Have safe weeks, and we'll see you next week. Bye.